Hi guys, welcome back to my YouTube channel. It's Tere Girl and I hope you have been enjoying my other 3 videos. If you're a new subscriber, welcome to the family. Welcome, feel at home. If you're a returning subscriber, hi, how are you? You good? Okay guys, on today's video we'll be talking about careers in the health sciences department, but I have narrowed it down to the radiology department just so I do not wander around, yeah. Okay, so first we've got our cleaners. We can't do anything without our cleaners having cleaned the room, and then after them cleaning the room we follow, could be before or after, we follow and clean the machines in the X-ray department. But yeah, the cleaners do not touch the X-ray equipment. They just clean the floor, windows and walls, but the machines, no, it's a no-go area. And then after that comes the porters. Yes, the porters are the ones responsible for transporting the patients around the hospital from their ward to a certain department, example radiology department, to get their scans done. And then when they're finished with their scan, and they're responsible for taking them back to the ward. So next comes the receptionists. Yes, so the receptionists are responsible for recording the patient's data into the RIS, which is radiological information system. Yes, radiological information system. And then after capturing the patient's data, they are responsible for transferring it to a particular modality or a relevant modality. By modality I mean x-rays, computer tomography, mobile x-rays, and you name them. Other than that, we have what? Oh, MRI. MRI stands for magnetic resonance imaging. Sorry. So that's where they use magnetism to capture the patient's anatomy, And then after that, we have... Okay, those are the ones I remember for now. And then after receptionists, I'm going to move to the radiographers department. So as a radiographer, it is your responsibility to always introduce yourself to the patient and confirm if you have the right patient. The responsibility of a radiographer is to confirm patients' details and position patients in the manner that they'll be able to acquire diagnostic images. There are some images where a radiologist won't even know what to do when they see that image, That is not a diagnostic image. Like, you can't diagnose a patient based on that image, Yeah, so it is really important to be good with your technique in the room, and you should know how the machines in the room operate. There are different manufacturers, so as a radiographer, it is your responsibility to seek training when you are hired somewhere. You don't just sit around and expect someone to come and ask you if you want or need a tour. No, like, it is your full responsibility to know your way around the hospital. If you don't, then why are you sitting down? So there are diagnostic radiographers which work in the general, they work with the general x-rays, your mobile x-rays. Mobile x-rays are those ones acquired in the ward. You go to the patient, you x-ray the patient in the ward. And we have computer tomography, CT scan. It also uses radiation. We have magnetic resonance imaging. You have to be really experienced to get into the MRI field. We have the cath lab. Yeah, we have cath lab, we have theater. Yeah, so when a patient lays on the bed to be operated on, The radiographer also needs to be there to guide the doctor on where they should go with their screws and stuff like that, you know, in theater. So it's kind of cool to watch the whole process. It's just so sad that they sometimes call us the button pushers. But guys, we do a lot of work in the department, like you won't believe it. If you were to come into our department and saw the amount of work we do, you would really respect us, like, period. We work hard. We work really hard, and that's why we went to school. You know, it's not just something as simple as ABCD. No, we need to study to acquire diagnostic images. And then moving right along, we have a radiation therapist. Radiation therapist, yes, radiation therapist. So that one is responsible for capturing, okay, no, they're responsible for doing examinations that will help you or treat you maybe when you have your cancer. And yes, they work with the oncologist to give you the treatment that you need for your condition. And then we also have a nuclear medicine technologist. They also they are really experienced in checking the progress of your condition. Could be cancer. It's mostly cancer when it comes to the radiology department. Like, if it involves a nuclear medicine, a radiation therapy, it mostly has to do with cancer, like they're treating patients who are affected by cancer. And then we have your sonographers. Sonographers deal with high volume sound waves to acquire images. Yes, so when it's, I think people are more familiar with it when you refer to pregnant women. So when you're pregnant and you go for your sonar scan, a sonographer will be putting gel on you or on the probe, you know, that thing that they move around your belly. Yeah, we call it a probe. They will be moving it around using the gel just to see how far you are, if the baby is okay. So that's your sonographer. Okay, let's go on an ad break. So here I was at the induction on my first day of ComServe. Then they took us on a tour on the second day. And on the third day I went to observe theater, and then I got to use this cool x-ray tube. You can move it using a remote. Like, how awesome is that? Look at that, guys. And then after this day, oh yeah, there are bubbles everywhere. That's just a snap of myself on day 8. And day 9, I think I went to theater by myself. I'm not really sure. And this is the mobile machine we use to x-ray patients with in the wards. Okay, let's catch up. So we've already talked about your receptionists, porters, cleaners, your radiographers, and now we are going to talk about mammographer. Mammographer is a radiographer who specialized in the imaging of your breast. And this is a perfect month to talk about mammographers because this is Breast Cancer Awareness Month, and there are quite a number of videos running around, or rather trending, about how to check for lumps on your breast. I don't think it would be appropriate for me to do that, so I'm just gonna leave links on where you can find those videos. So from mammographers, I'm going to move to the nurses. I am a boss. Yes, those are the bosses of the hospital. I don't think a hospital can be functional without the nurses. I really don't think so. So I'm gonna keep talking about the nurses even when we're in the radiology department, because they are practically everywhere, you know. The nurses in the radiology department have different roles from hospital to hospital and radiology to radiology department. So it depends on which hospital they're working at. For those patients who would come to the department without having their catheters on, meanwhile their procedures needed them to have catheters on, they were also responsible for putting on the drip, and that is mostly done in our CT department. Yeah, we
administer the contrast into the veins intravenously. Yeah, what did I just say?
We usually administer the contrast intravenously. They could also do what, I don't know, man, they really assist. Okay, moving on, we're going to talk about the radiologists. Okay, so radiologists are specialists. They are doctors who have specialized in medical imaging. They are responsible for reporting on every kind of imaging in the radiology department. So yeah, radiographers cannot report or tell a patient what they've seen on the skin. Doesn't matter the level of education that you have, but in South Africa specifically, I know in other countries apparently radiographers can report and they work hand in hand with radiologists, but in South Africa we have not reached that point in our careers. So yes, you are not allowed to tell a patient about their scans. And if you go to a hospital and you do your x-rays, please do not make the situation awkward by asking your radiographer to tell you what is really going on. Wait for your doctor to tell you about the outcome of the images, and yeah, that's where you'll ask your questions and stuff like that. And do not promise them that you're not gonna tell anyone. It won't work. It really won't work. Thank you guys for tuning in. I really appreciate it. I hope you enjoyed this video. If you feel like there's something I need to touch more on, please comment down there below. If you like this video, please give it a thumbs up. And yes guys, let's keep talking about these things. What are your suggestions on my next content about medical imaging? Thank you. Bye.